Hi, MLA Pete Guthrie here. There's been a lot of discussion around masks, their usefulness, and whether they should be mandated or to just allow society to take personal responsibility with their decision-making ability. Early on in the COVID-19 outbreak, many found the international health advice to be inconsistent. One factor, initially shared by most experts, was that masks were not effective in containing viruses. The WHO, Dr. Fauci in the States, and Dr. Tam in Canada were not recommending the use of masks. So the focus was on flattening the curve to keep cases of the virus at a manageable level and avoid overloading the health system. The premise being build herd immunity and allow the virus to work its way through society at a slower rate to give doctors, nurses, and other health workers the opportunity to care for their patients. So we social distanced, improved hygiene regimens, reduced essential services, and isolated. The result achieved the goal of flattening the curve. And in Alberta, the health system was maintained well below maximum capacity. Even at the height of the pandemic, when positive result rates were 7 or 8 times what they are now, masks were not recommended. Naturally, it was important for health workers to wear N95 masks to protect themselves and their patients. So why was it not recommended outside this environment? Well, the application is different. Proper use of a mask is to sanitize, then apply the mask, taking care not to touch the mask again unless you've re-washed. If the mask gets moist or is touched, it should be disposed of and cleaned immediately. This is an obvious issue in the general public. People are constantly touching and contaminating their mask. Additionally, overuse, lack of cleaning, and reuse of masks can have a detrimental effect and actually contribute to the spread of the virus. So do masks work? Well, sure. They can have a positive impact if used correctly. Masks currently used for public consumption are not sealed, and microorganisms, they can get in or out around the edging. And the mask itself, it will capture a large particulate and may reduce the spread by removing that large portion of contaminant. And for this reason, practicing of social distancing and good hygiene are also still important. If you knowingly have the virus or are asymptomatic, simply using a mask is not adequate. It's not a shield. If used improperly, you'll end up as a walking petri dish, contaminating others with airborne particulate and handling of items. So touching your mask, which everyone does, or pulling it up and down or having your nose out is not proper handling. A mask can provide comfort, but one shouldn't feel that a mask provides them with a cloak of invincibility. FYI, some municipalities in Alberta have chosen to mandate masks, but our chief medical officer has not made that recommendation. And as long as the health system is not overwhelmed, I would expect it would stay that way. Now, thus far, I've been speaking from the perspective of a mature adult. And in Alberta, the government is implementing a mask policy for grades 4 to 12. And some school boards are taking that a step further and mandating masks starting in kindergarten. For kids, applying all the hygiene and social distancing protocols is going to be tough enough. But now add a mask into the equation. I must admit I have some reservations about the effectiveness and practicality of this mandate. All parents know that kids transfer germs in a school environment, so transmission is probable, but medical evidence has shown that children are significantly less likely to catch COVID-19, and for those that do, the symptoms are significantly reduced. In a school environment, kids will lose, drop, and not effectively care for a mask. Tell a child not to touch the mask and they will instantly touch it. It's hard for me to see how this makes medical or practical sense in the classroom with young children. If it were, say, older students, say 9 to 12, it may be a more sellable argument, but we'll just have to wait for the results. With COVID-19, we're no longer working in a theoretical model of unknowns. We now have empirical evidence to draw from. We should use that data to better our decisions. This virus could be with us for years, and we cannot live in a bubble, sheltered and in fear. Children, as with adults, need interaction. They require an education and transition back to a semblance of normal life for proper development and to avoid isolation. In a school environment, high-risk students can homeschool or have the option of online learning. And for at-risk teachers, each school board will look for other options to serve teaching roles. Polls conducted of Alberta parents indicate overwhelming support to get children back to school. So why is this being so politicized? One side state that the wearing of masks should be left to society to monitor. They suggest mandating of masks is a means of control and an infringement on their personal rights. They say the mandating of masks is symbolic of leftist ideals to silence individuals, that it dehumanizes people to make them faceless and expressionless. They also point to the fact that the health system is well within manageable levels and not overwhelmed. They say we should, or we have achieved our goal of flattening the curve, so let's protect the most vulnerable, test extensively, and let others live their lives to build herd immunity. The other side argues that public health trumps individual freedom and that the collective whole should take priority. They point to medical benefits of masks in reducing the spread and feel that 0 cases should be the goal rather than herd immunity. Much of what you see in this regard points to political positioning. If you look at the organizations and opposing viewpoints around masks, they're the same groups that are rivals in the political realm. So it should be no surprise that they're going to continue to be at odds, taking the opposite view on every subject. Some factions want to use the issue to rally supporters, strengthen their membership, or gain a stronger negotiating position. The Notley NDP follow their typical American-style political gamesmanship to be as disruptive as possible. Throughout the pandemic, they opposed the government on every initiative, rarely cooperating or collaborating in a positive fashion. The continual political maneuvering and campaign of misinformation by the NDP is disappointing. Recently, the Notley crew have been encouraging protests at political offices to pressure government to reduce class sizes to 15 students, a move that would require hundreds of new schools and thousands of teachers, a request that clearly cannot be satisfied. They construct this no-win situation to instigate animosity through moral posturing. The implication being that the outrage they display must mean that they are correct, and government should apologize and cave to their virtue signaling demands. In my opinion, their disdain for government gets in the way of sound decision making. Their willingness to cause angst in society and use the pandemic as a means of control and political posturing will not serve them well. At least it shouldn't. The general public will catch on. The NDP's gaslighting and perpetuation of false information will cause people to discount their continual outcry. Albertans and Canadians had tremendous success throughout this pandemic, and we should be proud of that fact. This virus does not discriminate based upon what side of the aisle you are on, so the fear-mongering from the opposition does not serve the public interest in any way, shape, or form. And the fact that Alberta has amongst the highest testing regimen per capita in Canada and did an excellent job managing this unprecedented worldwide event. We understand that it is important for us as a society to get back to regular life. And we have observed evidence where people are most at risk that the use of masks is higher because individuals use good judgment in those situations. It makes sense, and it is the responsible thing to do. For our own personal well-being as well as our economic future, we need to move forward. Our health system is successfully handling the load. So with continued diligence, following health protocols, we can keep it that way. Let's trust Albertans and Canadians to make sound decisions. Thank you.